歡迎大家出席。
Welcome to today's press briefing. We have with us three speakers. They are Dr. Edwin Choi, Controller of the Center for Health Protection, Dr. Chang Shuk Kwan, Head of the Communicable Disease Branch, and Dr. Sarah Ho, Chief Manager of the Hospital Authority. We'll first hear from Dr. Choi. Good afternoon, everyone. Before we hear from Dr. Chang, I would like to talk about vaccination, the vaccine pass, as well as the recovery code. The epidemic might have stabilized, but with the high transmissibility of Omicron, we should remain vigilant. Vaccination is still an important initiative in the fight against the epidemic. In the fifth wave, we have recorded serious cases and fatality cases amongst elderly people and youngsters. They are our target protection group. For those who are above the age of 60, over 80% of them have received the first dose. That means there are about 400,000 elderly people who have been unvaccinated. For those who are between the age of 3 and 11, for the first dose vaccination is about 71%. The vaccination program rolled out later than others, but we see that the vaccination rate has been climbing up. We appeal to members of the public, parents, to take your children to get vaccinated so that they can start to build their protective barrier. At the end of this month, we will roll out the requirement of the third stage of vaccine pass. We receive inquiries in relation to vaccination record as well as recovery record QR code. For various reasons, they have not been vaccinated. They asked how we can meet the requirements under the vaccine pass. These are their concerns. First, they are worried that they will be physically unfit for vaccination. They are also worried that they are concerned about the appropriate time to get vaccinated after they have been infected in the fifth wave. And they're also concerned about various possible side effects of vaccination. But I'd like to share with you some important data in relation to the merits of vaccination. According to the Hong Kong U, they have done some studies in relation to vaccination. If people have been vaccinated 3 times, whichever the vaccine, they are protected against serious cases for over 98% if you're an adult. And in relation to protection against serious cases, the enhanced protection is between 72% and 96%. So whether you are vaccinated with Sinovac or BioNTech, you will be better protected against fatalities or serious cases. At the peak of the fifth wave, there are a lot of people, because of various reasons, technical reasons or other considerations, they have not reported to us their positive cases. As a result, they are not sent isolation orders. We have been following up on their inquiries, and in the past few weeks, we have received about 80,000 requests for assistance. We have sent out isolation records. We don't have a backlog of inquiries. However, every day we have been receiving similar requests. There are also inquiries about positive cases that have not been reported in the fifth wave. As a result, we don't have their positive record. They ask how we will deal with their vaccination arrangements. I'd like to say that vaccination, the advantage of vaccination far outweighs the disadvantages. 1 month after you have recovered from COVID, you can safely receive a vaccination. So if you have not been reported to us, your positive case it's been over 1 month, so you can safely receive your vaccination. Those who are concerned, please do not hesitate. Get vaccinated, and then you can fulfill the requirements under the vaccine pass, and you can maintain a high level of antibodies. In relation to those who have obtained recovery record QR code, The QR code is valid for 180 days, that is 6 months. But I appeal to those involved not to wait for till the expiry before you make arrangements to get vaccinated.
首先歡迎大家出席今日
Currently,
嘅記者會啦，
vaccine may
介
not
紹一下台上三位官員， 中間
protect you
嘅係政
against
府經濟
infection,
顧問
but
梁永勝先
it's
生，
very
而佢
effective
旁
in
邊咧分
relation to
別有副
prevention of
政府經濟
fatalities
顧問
as
侯
well
家俊
as
先生，
serious
同埋政府
conditions.
統計處助理處長洪少文女士。稍後梁
Virus
先生同侯先
continue
生
to
會先後用
mutate,
廣東
and
話
there
同
are
英文
some
介紹今年
secondary
第一季本港經濟情況，同
variants
埋
of
政府對於
Omicron.
全年
We
經濟
can't
增
rule
長
the
同埋物價
possibility
嘅最
of
新
new
預測。
variants
咁
that
最後就
are
有答問
more
環節啦，而家先
transmissive
麻煩劉先生。
or more
大家
fatal.
好，
So it
首
is
先歡迎
better
大家
to
嚟到今日呢
build
個記者會啦。
individual,
咁我今日
family,
會
as well
講一
as
講第一
societal
季香港經
barrier.
濟嘅整體表現，
There are
同埋政府對
126
今年全
positive
年經濟
cases,
增
including
長同埋通脹
23
嘅最新預測。
confirmed by hospital authorities,
首先
31
講幾個要
confirmed
點
by
先啦。
public health laboratory service,
其
and
實喺
72
今年
confirmed
第一季
by
咧，
private
本地
laboratories.
出口
There are
同埋本地經濟活
172
動
cases
都急
that
劇
are
轉弱嘅，
RAT
咁所以香港
positive
經濟喺
cases.
第一季
So
咧就明顯
altogether,
惡
we
化。
have
咁按年咧就
298
收縮
cases.
4.0%嘅。
Cumulatively, we have
咁失業率咧亦都顯著上升嘅。咁展望今年餘下嘅
1,195,732
時間啦，咁
cases
喺
in
外圍
fifth
方面咧，
wave.
咁烏
And
克
there
蘭
are
嘅局勢持續緊張啦。咁主要
747,542
央行
PCR positive
可能
cases,
要加
as well
快
as
收緊貨幣政策以抑制通脹嘅，
1,790
咁就會令到
RAT
環球經濟
cases.
前景
We
轉
have
差。
conducted
咁呢個咧係有
basic
可能
genomic
影響到我
cases.
哋
Out of
往後嘅
69
出口表
cases,
現嘅。
they are negative
咁
to
但另一方面咧，就係話
L452R,
跨境運輸
and
不暢嗰
9
個情況咧，
samples
就有
with
機會咧係逐步會
viral
慢
load
慢
that
緩
is
解
too
嘅，咁
low.
係
There are
可以提
21
供到一
imported
啲舒
cases,
緩。
including 13
咁本地方面啦，咁就
PCR
疫情
positive
減退，
cases and
咁
8
社交距離
RAT
嘅措施
positive
亦都逐步
cases.
放寬，
6
咁再加上政
are
府
picked
各
up
項
at the
嘅支
airport.
持措
They're
施，
all
咁
arriving
應該
on
咧
the
係可以
12th
支
of
持
May.
內部需求咧係慢慢恢復翻嘅。
2AC0073 QR818
咁綜合晒所有考慮，
and
我哋就將
1SQ882
2022年全年嘅經濟增長預測咧，就
that are
向
picked
下
up
修訂至
from
1
quarantine
至
hotel. They are
2%。
samples between the 3rd and the 7th
咁
day,
講
and
講
there is
個
one
詳
that
細
is a
情況啦。
12-day sample.
咁就
For
整
that
體嚟
case,
講啦，
is a
咁整體嚟講，
25-year-old
頭先都講
female
過，香港
arriving
經濟
from
第一季明顯
Singapore on
惡
the
化。
20th of
咁我哋
April.
睇左
On the
邊嗰幅圖咧，我哋就睇
20th of
到
April at
按年咧就
Singapore,
收縮
he was a
4%。
positive case.
咁按季
On the 9th of May,
再經過季節性
after
調整
he
之後
has
咧，就收
departed
縮
from the quarantine
3%嘅。
hotel, he did a
咁喺右
test
邊嗰
and
幅
it
圖
was
咧，我哋就
positive,
睇
but
到
the CT
其
value is
實
close
主
to
要嘅一
40.
啲開支組
So
成部
it's a
分，
very positive
無論
case.
係貨物同
In
服務支
relation
出
to
啦，
genome sequencing, we
私
have
人
an additional case of BA2.12 picked up at the airport from the US via Japan, arriving on the 7th of May. On that day, that person suffered from a sore throat. Currently, for BA2.12, there are 7 cases, including this one. We have another 8 cases of BA.1.21. Altogether, 19 cases. They're mostly from the US. There is one from the Netherlands. Most of them are picked up at the airport. There is one that is a 3rd-day sample at the quarantine hotel. The others are picked up at the airport. In relation to care homes, we have no new positive cases. For schools this morning, there were no classes, but we've received 3 cases from schools reported. They are all RAT positive cases, 1 student and 2 teaching staff, involving 3 schools. Nothing special about these cases. Of death cases, there is another 3 death cases reported by hospital authority. Altogether, we have 9,068 cases reported by the HA, and including non-HA reported cases, we have 9,146 death cases in the 5th wave, involving 3,773 female and 5,773 males. We don't have anything in particular to add. About some clusters we mentioned yesterday. There are some updates. At Saiwan Estate, we have conducted an RTD, that is restrictions and testing declaration, involving about 1,600 people getting tested. We have picked up 22 positive cases, 16 from West Terrace and 2 from Middle Terrace and 4 from North Terrace. For West Terrace, there are 5 cases. There is one family member that's tested positive. So altogether, we have 6 cases, including 16 cases picked up at West Terrace. We have identified 22 cases involving 14 units covering 8 floors and 5 directions. For North Terrace, there are 3 units and 4 cases. For Samwong Club, we found 4 cases and another 2 additional cases, altogether 6. 2 of them know one another. There are some snooker tables as well as billiard tables. There are 6 people engaged playing over 3 billiard tables, 1 snooker table and 2 billiard tables. For the 2 billiard tables, they are quite close together. We have obtained 28 environmental samples. There is 1 sample from a billiard table that is positive. We suggested to Samwong Club to carry out thorough disinfection. We're still waiting for compulsory testing notices to see if we have new cases. Yesterday afternoon, we have identified another restaurant that has an outbreak. So far, there are at least 29 patrons and 1 staff members that are tested positive. It's a Shangwan catering. It's a Shangwan restaurant, Xingyue Lao. People dine between 6 and 11 p.m. So those who have been there will have to be tested. There are 28. There are a number of patrons and 12 female and 17 male. There are over 200 customers involved and about 50 staff members. They all have to get tested on a compulsory basis. For customers, well, it was the 3rd floor and there are some tables on the 2nd floor. Most of the customers are on the 3rd floor. We're still looking at their seatings and other factors. There are some families there. This morning, we went to the restaurant to have a look. Sky Cuisine, we have obtained 48 environmental samples. EMSD staff members have also visited the restaurant to check their ventilation. We appeal to those who have been to Sky Cuisine on the 7th of May between 6 and 11 p.m. to get tested.
Now, Dr. Ho would make a report on the HA situation. We have 799 positive cases hospitalized in our infection control centers and hospitals. There were no new cases of critical patients, and no critical patients are now remaining in ICUs. There were 3 mortality cases reported. 1 80-year-old male who passed away on the 11th of May, and another 2 passed away yesterday, a male and a female patient, aged 84 and 86 respectively. They were rather old. They were over 65 elderly persons, no one from the care homes. 1 patient had no vaccination record, another had 1 jab. In the 106 patients have recovered, 68 have been discharged. since the start of the fifth wave, we have 49,229 patients who have recovered, including 48,687 who have been discharged. Since early 2020, we have 61,609 patients recovered from the infections, including 61,067 who have been discharged. One patient was tested positive on admission to hospital. Another patient in the same hospital ward is now a close contact. We have, for HA staff, we have 22,782 staff members who have been infected. 22,226 have now returned to work. We now have a Q&A session, the one at the second last row. Hong Kong 01. With regard to CHP's and the EMSD's visit to the Sky Cuisine for sample taking, and you were also taking samples from the toilets. So I believe there was some alteration to the toilets, and I would like to know the reason for doing this. And also, what about air ventilation? Is it up to your the required standard? And there's a notice saying that they are using also the air purifiers. So why is it that the air quality is still not up to scrap? So it's 29 patients and another one staff member were tested positive on Saturday. As for the billet customers, there were samples from the table surface that turned out to be positive. Would you say that all those customers who have went there on the 7th of May should be tested? So they should be, who have been to the Sky Cuisine restaurant should be tested? Well, usually we would take the samples, and then depending on the result, we would chart our way forward for further that investigation. We took 48 samples this morning from all the high-risk locations, and toilets are always considered high risk because there are people using them, then there will be people gathering them. So normally we'll take samples from such locations. As for ventilation, we have to wait for information from EMSD. I'm not an expert in this regard. For the time being, on the evening of the 7th of May, it seemed that there was an outbreak, but we cannot rule out that there were other cases undetected. Testing is easy. I believe people who have been there should go for a proper test. The gentleman there at the back of TVB. I wanted to ask a follow-up question about Saiwan Estate. You have discovered some 20-odd cases. Why is it there were so few? Or have they been infected at some time before? And he said that it was that the sample count value was millions as compared with ordinary cases. Do you have a super spreader there? Have you resolved the problem associated with this spreader? As for the Sky Cuisine and also the billiard hall, would you say that people who visited these two places after the 7th of May should also get tested? As for the swapping of the dead bodies by HA in Tuen Mun Hospital, can you inform us of the update of your investigation? We have an RTD to carry out in Saiwan Estate. Some 20 or 22 positive cases were found. During the previous waves of the epidemic, we did a lot of sewage sampling test. Well, it had to do with the number of positive cases as well as the viral count. For this case, we found 6 million copies per liter, compared with what we found in March or April is 400 or so per liter. So we are talking about a big, not potentially a big number of cases, but it can also be due to the discharge of a large amount of virus or of a positive case. So some 20 odd cases I would say reflect the real situation. And we also distributed testing kits to residents living nearby, since we have this RAT platform that people can use. So for those who live in the vicinity or who have been there, that is the vicinity of a Sai Wan estate, the test would inform us of the ongoing situation there. As for Sky Cuisine and the billiard halls cases, well, we would like to know whether there were a number of people who were there together. Well, for the restaurant Sky Cuisine, it was during the evening dinner time. It's the 7th of March, 7th of May, and we believe that there were many customers there. The source of the infection might not just went there only on one day. So we would issue more compulsory test notices to relevant people if there's a need to do so. And since we have the vaccine pass system in place, tracing them will be easier. So we'll know very quickly who have been there. So for this CTN result, I would defer to Dr. Jiang. You mentioned the viral count of Sai Wan estate. Well, the CT values of the affected were on the low side, 10 something, 20 something.
I'll defer to Dr. Ho about Tuen Mun Hospital. But today's press briefing is on COVID-19, so we would like to just focus on the epidemic situation. As far as I know, in relation to Tuen Mun Hospital incident, they have already released a press statement. I understand that they will follow up on this matter. Next, the lady in the middle. I'm from Now TV. First of all, I'd like to ask about Sai Wan Estate. I noticed that there are numerous cases at West Terrace. Can you tell us whether there is an outbreak within the estate? Should residents refrain from eating out? What do you think is the transmission chain is within that estate? Next, I'd like to ask about Sky Cuisine. It seems that the Dr. Cheung talked about the number of people who've been infected. Is it 28 or 29? Is it the case that there is a super spreader, or is it a transmission by air? What is the distribution of seating of those infected? Would you follow on these cases? Staff members, do they have to be quarantined? Do you reckon that there will be more cases coming from Mother's Day? We have seen more and more clusters. How do you assess the risk of a rebound? Professor Yoon Kwok Young said that, well, we should contain the virus because the virus will stay with us. So will that change the strategy of fighting the epidemic on the part of the HA? I would like to first answer a few questions before we talk about Sai Wan Estate and Sky Cuisine. At this stage, we believe that every day we will see 200 or 300 cases for quite some time because there are still transmission chains in the community. But experts from universities have given us their input in the analysis of the epidemic. In a fifth wave, a large number of people in the local population have been infected. And we also have an increasing vaccination rate. So the two factors help to contain outbreak of a large scale. We see clusters from restaurants in the past 2 or 3 weeks. They are sizable clusters. We try to identify irregularities or some unusual factors, hoping to pick out these clusters as soon as possible. We make use of compulsory testing notices to pick out those who are infected so that they can be isolated to prevent further transmission. If we identified environmental risk, we may ask the premises to stop operations so that we can stop the transmission. In relation to the next step, we will first need to tackle the current situation. Well, at the peak in March, we have about 77,000 cases a day to now we have about 200 or 300. We do first need to contain and control the epidemic. Dr. Chuang, we're still carrying out investigation in relation to Sky Cuisine. We need to find out the people who are at the meal, whether they have infected their family members. There may be cases when they have done the RAT but have yet to report to us, so there is a chance that the number will increase. There are 29 customers and 1 staff member. But because of the sudden increase in number, we are still trying to ask questions. We are investigating into the distribution and seating, but we need to verify the information with that bill. We have obtained information from the vaccine pass, but it doesn't indicate the table number. So we need to verify the information. It will take time. Staff members will need to be tested, but at this stage, not quarantined. As to what advice we can give to the general public, with a relaxed social distancing measures, there will be more gatherings in the community because there is still virus in the community. There will be further infections. The most important thing is to is a vigorous personal hygiene. What we need to do is to keep number of cases of serious conditions and fatalities to a minimum. So we need to get a higher vaccination rate. If you have not completed a full course of vaccinated, or if you are unvaccinated, then the chance of a serious condition or death case is higher. So those who have yet to complete their course or have yet to start the first dose, please do so as soon as possible. The virus is still in the community. If you are infected, then you're subject to a higher risk. The gentleman over here. Saiwan Estate. Well, if it's within the same building in previous times, we have identified a high number of cases in the same building, as we've seen in previous RTDs. There are communal areas, people share the lift lobby. We have high density apartment buildings, so that is normal. And in relation to U-traps, sometimes they've dried up, and as a result, there is transmission.
For the Sunwong Club cases, some experts are suggesting that we are going to see more such cases with the relaxation of control measures. People will be doing exercise in indoor venues. They need to breathe properly, so they may take their masks off. So are you going to remind such venues that they need to check their ventilation system to see that it works properly and to prevent such outbreaks? Well, yes, there's a risk when your mask is off in an indoor venue. However good the ventilation system may be, if the distance between individual people is very close, then there is a risk of transmission. But if ventilation is efficient, the virus will stay inside the venue for a shorter time. And that is when another customer goes in, the virus discharged by the previous customer may not affect the second customers. We need to work this out with the industry, because with the second phase of relaxation implemented, and since there are also cases in the community, we need to continue to work hard on control measures, including sanitation and air ventilation system. And we all know that what good ventilation means, what we should do when you use the toilet. And there are professional people who cannot help with installation of proper exhaust systems for better ventilation. And people should go to see a doctor if they feel unwell, or go and do an RAT test. And if you are RAT tested positive, you should stay home. We have also got some isolation facilities to cater for the needs who need to be isolated there. From Ming Paul. Dr. Jiang, a question about the cases. You mentioned Sky Cuisine have registered some cases with customers seated on the second floor. Or would the toilets be used by staff members and patrons on both the second and the third floors? And there was a previous outbreak with Sky Cuisine. Is there anything problematic with the or systematic with the problem, or is it just a coincidence? As for the snooker hall, what about wearing a mask by the patrons? Have you taken samples from the hall? And a few days afterwards, you still discover positive cases. Is there a need to close the billiard hall? Or are we talking about imported cases here? So for Peony Golden Court, Sunwong Club, and Sky Cuisine, have any of those who have been infected deteriorated to become critical? And there was a case involving a 117-year-old patient. Can you tell us more details? And the summer is coming. Is there a case for allowing natural boosting if they want to go for some low-risk activities. And Dr. Ho, how many beds do you have, maximum number of beds that you have that can accept, admit COVID patients? We're still asking information on the seat numbers, the sitting arrangement of the customers. And sometimes they were confused whether it's the second floor or the third floor. And we've been told that there was one who died on the second floor. We have to find out whether that was actually the case, because there were very few people there on the second floor on that night. As for ventilation, the MSD people to make a visit, we have to wait until their test results are out. We have taken some environmental samples from Salmon Club. Only we have discovered something positive from the surface of the billiard table. We've asked Salmon Club to stop operation, clean up the places before reopening. We haven't found out any critical cases from arising from those that I've mentioned. Do we have any mortality case of critical patients? No, not for the time being. We're still investigating. On environmental sample, in the past there were cases whereby the environmental samples were tested positive, but it doesn't mean that it was a very highly polluted area, because our tests are very sensitive. For example, if someone sneezes and it landed on the surface of a wrapping, then we can still find some positive samples from that surface. So we found some samples from the surface which were tested positive. We've asked, as Dr. Zhang said, we've advised the billiard hall to go for a complete cleansing and sanitation first. And we have to make sure that our public hospitals are not overloaded. We have to protect the system, so we need to monitor the utilization situation. Maybe the number of cases is small, but if they are serious, that would bring a lot of pressure to our public healthcare system. For example, we have to pay attention to the waiting time of people in the A&E department, and how many COVID patients have to wait for the quarantine or for hospitalization, how many need oxygen support, how many are ICU, etc. Professor Yun has advised that we should not just look at the number, we just monitor the number of confirmed cases. As for the summer, for the coming summer, we would consult our experts. If this is to become an endemic disease, then we have to adopt some different strategies. We will have to allow for a low level of transmission in the community, which will not result in a large number of patients having to be admitted to hospitals. During summer, maybe the virus is less active. So what's our strategy for the summer? We have to do this step by step, because we just seen the easing off from a peak to some 230, 300 cases a day, that we have to make provision for a change in the development.
We have about 800 patients staying at hospitals that are confirmed to have been infected with COVID. Demand has dropped. We have about 10,000 beds for COVID patients. As Dr. Choi said, we will monitor the changes of the epidemic situation. We will maintain our flexibility to ensure that whether there are hospital beds or A&E department capacity will be able to cope. In relation to ICU, the current utilization rate is about 55%, and there are no COVID patients. The lady at the back. We have about 100 or so negative pressure beds in the ICU. The lady in a black cardigan. I'm from cable TV. I'd like to ask about Saiwan Estate. You said you have identified 22 cases under RTD. In the past week, how many cases came from Saiwan Estate? Hong Kong U sent emails to teaching staff and students not to eat in the Western District. Well, you're aware of the situation. How come that you did not make an announcement? You have underestimated the severity. That's why the Hong Kong U has to make their own announcement. So about the Tuen Mun Hospital swapping of cadavers, well, are these two patients died of COVID? Why was there such a mistake? And if they have been infected with COVID and because of the mistake, does it mean that those who are involved in the process will be exposed to risks? I would defer to Dr. Ho about the morgue incident. First, about the cases in Western District. The Saiwan Estate cases were identified as a result of a sewage surveillance program. As soon as we are aware of the data, we've made a decision to take action. Say, for example, the RTD and distribution of RAT kits to residents. When we carry out contact tracing, we try to find out where these people have been. I don't really agree with you that we have acted late. I'm not going to comment on how the Hong Kong U contacted or disseminated the information to their students and teaching staff. We took action yesterday, so I don't agree that there was any lag. For the snooker room, the restaurant in Yuen Long and Sky Cuisine, we took immediate action. There is one case on the 8th and another case on the 11th, and yesterday, that is the 12th, there were 3 cases. So when I made the announcement, there are 5 cases. 3 were known yesterday. That's in relation to West Terrace. Afterwards, we found out that there was another case that is a family member. So in the past dozen days or so, there are about 6 cases. With the compulsory testing, we have another dozen cases or so. So altogether, 22 cases at West Terrace. The Tuen Mun Hospital, one is not a COVID patient. The other one was a recovered patient. So their bodies were classified as Category 1 bodies. In the press release, Tuen Mun Hospital has given details about the incident. That's why I said that we should focus on the epidemic in the press briefing on COVID updates. In relation to the incident, the Tuen Mun Hospital has expressed their condolences to family members involved. They have set up a committee to look into the matter and to review the workflow of handling of bodies. Relevant staff members have seen their duties suspended. Reminders have been sent to those who work at the morgue that they should strictly abide by procedural requirements when it comes to identification of bodies. I'm from Orange News. First, about the snooker room and the additional 2 cases. What is their age? When was symptom onset? And in relation to the 3 billiard and snooker table, how far apart are they? And what is the location in relation to the snooker room? Experts said that inside, if people are apart, are 2 meters apart, there is still a chance of transmission. So what advice do you have to reduce transmission risk? Dr. Choi, you said that there is a chance that they may be a more transmissible and more fatal variant. So does it mean that antibodies generated from vaccination or infection is not able to withstand new variants? For the new additional cases, 27-year-old males. Two tables are side by side. For the 2 billiard tables, there are 4 people playing there. I don't think that they are too far apart. And you won't be stationary, you will be walking around. So there might be some contact during the process. To reply to your question, it's very difficult to tell how the situation will pan out and what the next variant will be. But according to international understanding, the next variant will survive better. It will be more transmissible. Otherwise, it will not be able to outlive the last variant. As to fatality, it's difficult to tell. For BA.1, the transmissibility is very different from BA.2. So the amount of resources devoted will be very different. As you know that in the past 2 years, we have been adjusting our strategies. The initial thinking of vaccination is to prevent infection. But when we have vaccines available, that may be different from the original strain. Vaccination may reduce infection, but it's not 100%. But it definitely can reduce risk of serious conditions and death cases, at least in relation to the current variant. For when it's changed to BA.2, as to whether there is any difference in the effectiveness of vaccine, we see that vaccines are still effective, but we will not be able to tell the extent of the effectiveness in relation to the next variant. Every time there is a new variant, and they will need to carry out investigation before deciding whether modifications is needed in relation to the vaccine. It depends on how the mutation is before we can tell whether vaccine is still effective. But what we can see at the moment is that vaccination helps. And when it's effective against the current strain, and if you don't get vaccinated, then you won't know what is going to happen. So you do need to get vaccinated now.
For the infectious disease expert, Dr. Ho mentioned that the government could regularly announce the sewage testing result to the public. Does the government plan to do so? And do you think it can ease the public concerns? And also, we can see that the government has distributed some RAT test kits to residents to places like Kwun Tong and Southern District. Do you think there is a potential clusters over there? And for the Saiwan Estate cluster, for the Sky Cuisine cluster, we can see that it is added in the compulsory testing notice last night. So we would like to know more what are the possible ways of transmission over there, and do they come from like different families, and what are the distribution of the cases? So given the current clusters, do you think the government should further relax the social distancing measures on May 19th, particularly on extending dining hours and reopening of bars that also involve some mask-off activities? Thank you.
Okay. So maybe I'll ask Dr. Zhong to supplement on the Sky Cuisines incident. And then I will explain to you about the sewage testing and also the social distancing measures.
We understand from the vaccine pass that there are more than 200 patrons to the Sky Cuisine in the evening of 7th of May. So we would like to ask them, all of them, to undergo testing. So far, we have identified 29 patrons and 1 staff from that restaurant. So far, we are still interviewing the patients and their family contacts. So far, we understand most of them are sitting on the 3rd floor of that restaurant, and we are still ascertain the distribution of the cases in the table, the sittings. So we understand maybe more than 10 tables are involved so far.
Okay. So for the current surveillance measures, indeed there are a lot of indicators that we are looking for every day. So we try to be more transparent to let members of the public know what we are doing. But giving too much information like the exact sewage testing figures may not help to ease the people anxiety, because they don't know how to interpret the result. So indeed what we are doing now is, in case we found there's some abnormal signals, we will convert it into some actions, like we'll implement the RTD, the compulsory testing notice, and also the restriction testing order, so that those living in a high-risk area will get the instructions of what to do and what to be tested. So yeah, we know what Dr. Ho is advising, but we'll keep in mind to balance the information release and also the perceptions of the public and how to interpret the result, which is more complicated to the public sometimes. Okay, so for the social distancing measures in the subsequent stage, actually we are doing daily assessment, because every day is different. So today we got several outbreaks. So we take into account every assessment and everyday cases into account. So we have to put this to the overall assessment whether there's any change of the social distancing measures. But what I can reassure that the case number are still in quite steady conditions. And what we are doing is, once we detected any outbreaks, we try to contain the outbreak as soon as possible. So we try to contain it so that we don't want any case coming up so that it would affect our release of social distancing measures. So so my answer to you is that we have to monitor situations quite frequently. And at present, as Dr. Zhong reported to you today, the case number is about 300, which is similar in the past 7 days.
今日記者會完結，多謝大家。
唔該晒。
That's the end of today's press briefing. Thank you.